So, doctors, welcome to Pocket MBBS, where medicine fits in your pockets. Now, let's study today's topic. It is CNA pharmacology, in which we see sedative and hypnotic drugs, in which we include barbiturates and benzodiazepines. Barbiturates are bind to multiple sites in GABA-A receptors and it is low dose and act on GABA-A receptors. GABA is a facilitatory receptor and increase the frequency of opening. In high doses, GABA is act as a mimetic and increase the duration of opening. And in higher doses, it is non-specific and blocks the sodium, calcium, and glutamate channel. Mechanism of action of GABA is GABA attaches to alpha and beta junction and open that leads to opening of chloride chloro channel. That leads to narrowing therapeutic. Other features are narrowing therapeutic effect, low safety margins, required therapeutic drug monitoring, enzyme inducer like CYP and glucuronides, and it is highly addictive in nature and is non-specific antidote. Non-specific antidote if its poisoning occurs. Now, the treatment of its poisoning is forced alkaline diuresis by sodium bicarbonate and hemodialysis because it is acidic drug in nature. It has three types: ultra short acting, and long acting drugs. The ultra short acting drugs are redistributed in the fats, so they are ultra short acting, in which we include thiopentone. Thiopentone is also known as sodium pentothal, which route of administration is intravenous, and it is used as a general anesthetic, also as a truth serum or for narcoanalysis because it decreases the cognition and sedation causes. It is cardio and neuroprotective in nature because it decreases the oxygen demand to heart and neurons. It has anti-thyroid effects and it has 3 A's, means it is acidic drug mixed with sodium bicarbonate and alkaline. It is contraindicated in as arterial injections because it can lead to thrombosis and acute intermittent porphyria. What is acute intermittent porphyria? Acute intermittent porphyria, defective synthesis of heme takes place due to accumulation of porphyrin, which is abnormal, and that leads to pallor, anemic, and craving for blood, or abdominal pain is present, and vomiting and photosensitivity, which is a vampire-like symptoms. Now, it is contraindication of barbiturates is due to CYP enzyme inducer because CYP enzyme contain an heme and it leads to increased heme demand of the body. It leads to more porphyrin deposition and worsening of the condition. Now, drugs that are contraindicated are estrogen, oral contraceptives, barbiturates, alcohols, sulfonamides, valproate, ergotamines, and rifampicin. The second ultra short acting barbiturate, methotrexate. It is used to decrease the seizure threshold and it easily provokes the seizures. So, it is drug of choice for electroconvulsive therapy and it is used for the treatment of psychiatric disease. Other short-acting barbiturates are butobarbitone, amylobarbitone, pentobarbital, and secobarbital. Now, the sedative drugs are route IV in ICU patients during pre-operations. Now, the long-acting barbiturates are phenobarbital and pyrimidone. Pyrimidone is an active drug or active form of phenobarbital. Phenobarbital is an enzyme inducer. It is a drug of choice for neonatal seizures, neonatal jaundice, and Ziegler-Nagel type 2 and Gilbert syndrome. Deficiency of UDP-GT enzyme leads to glucuronide is not attached to bilirubin. That lead to bilirubin will not become water soluble. Increased bilirubin that leads to jaundice. So, the pharmacokinetics role of phenobarbital is it increases the UDP-GT enzyme and it is a CYP3/4 or CYP enzyme inducer, decrease the effect of other drugs and combined with the theophylline and warfarin decrease their effects. Then the side effects of phenobarbital are paradoxical excitation and hyperkinesia in children, induced seizures, increased sensation, increased pain perception and withdrawal symptoms and drowsiness. Now, pyrimidone. Pyrimidone is converted to phenobarbital. It is used for the treatment of seizures and essential tremors. Now, benzodiazepine acts on alpha and gamma subunit of GABA-A chloride channel. Its examples are diazepam, lorazepam, clonazepam, oxazepam, and flurazepam. It is used as anti-seizure drugs in which we give IV in status epilepticus. Drug is diazepam, lorazepam, midazolam. Insomnia drugs are flurazepam, temazepam, and astazolam. Pre-anesthetic medications are diazepam, lorazepam, midazolam, Anti-anxiety drugs are diazepam, clonazepam, oxazepam. Metabolism of benzodiazepines are: it is a class A drug. Diazepam, like active drugs, metabolized by CYP3A4 enzyme in liver that is converted to active form. Oxazepam, which is water soluble and excreted in urine. All benzodiazepines are excreted in such a way, but some class B drugs have alternate pathway in which the benzodiazepine in active form need no CYP3A4 enzyme metabolism in liver and they directly excreted in the urine. So these drugs are safe in liver disease like oxazepam, lorazepam, temazepam and astazolam. Now the longest acting benzodiazepines is flurazepam and shortest acting is nimamizolam. The adverse effects of benzodiazepines are drowsiness and sedation, dizziness, fatigue, confusion, and memory impairment. The withdrawal symptoms associated with benzodiazepines are anxiety, insomnia, tremors, sweating, and seizures. Now we will see Z compounds. It is a non-benzodiazepine sedative hypnotic drugs mainly used for short-term treatment of insomnia. It acts on an alpha-gamma subunit of GABA-A receptors. And examples are Zolpidem, Zaleplon, and Zopiclone. Its pharmacological actions are: it induces sleep rapidly, decrease the sleep latency, means the time taken to fall asleep, and it has total sleep duration is increased. Now it is used for the treatment of short-term insomnia, difficulty in falling asleep, and difficulty in maintaining sleep. It is contraindicated in severe liver disease and severe respiratory insufficiency. Its advantages over normal benzodiazepines are: it is faster onset of action, less daytime sedation, less effect on REM sleep, and low risk of tolerance and dependence. Now that's all for today's videos. Thank you. Follow for more such videos.